So here now I'm showing you the, here I'm showing the Google, how we have to go in the Google, right? So this is the some dot in the top in the right side. If you click, there's some apps come. You have to go down. Then this is the Google Classroom. If you click in this Google Classroom, this page will come, right? So if you click there, like I'm click there, and this is the Google Classroom content come. So if you are not part of this, I has to add you, but definitely I do not know you are part or not. You has to inform me. I do not have it, so I can add you from here. So in the Google Classroom, when you go, there are some review section, right? And also the different chapter by chapter we discuss here. So like NCLEX RN, total review, medical terminology, fundamental of nursing, pharmacology, mental health, and also review for LPN. It is RN and LPN, different little bit. So here I'm showing you the fundamental of nursing here. So if you go in the fundamental of nursing, the total content we divided by 2. Okay, one is the fundamental of nursing part 1, right? Fundamental of nursing resources part 1. So part 1, basically if you go, you get some PowerPoint, right? And this PowerPoint from 1 to 18, all of the PowerPoint from our textbooks. Okay, this is called Fundamental of Nursing Care Concept and Connection, right? So this is the book we like to follow, and definitely these books approved by the board, NCLEX board. So there's the 2 point here. If you like, you can download these books. If you like, you can download from here. Very easy. Just click on the top, right in the top, and you can get the option to download. So this is the book we follow, and this is the resources we use. And also you are the part of this Google Classroom because you're the part of the school. So here I said content here, right? PowerPoint. So when I has to go in the everyday, I mean Monday class, I finish or I can follow 1 by 1 chapter. Chapter 1, 2, 3 like this. I want to share something. Like today, the student name is A. He or she joined with me. And today we are going to chapter 1. But next week, a new student join with me. That times we has to go in chapter 2. So the new student who joined second Monday, like name is B, then they can start from chapter 2. So you can ask me, the student who joined later, they can miss the chapter 1. I said no, because this is the circling, like chapter 1, 2, 3, 4. When I finish, like chapter 18, I have done. After 18, I has to go in chapter 1. So basically, in fundamental of nursing class is organized such a way. If you stay with me today or tomorrow or sooner or later, you must get contact or you must get touch in every chapter. Your responsibilities, you should join in Monday morning and evening class. Basically, what I do, what I discuss in the morning, it is not absolutely same what I discuss at evening. So this is the opportunity for the student who can join morning, maybe they can discuss the chapter 3 and 4, but the evening student, they can follow chapter 5 and 6. So the morning student, if join in the evening, they can go for the new chapter. But now again, I talk about if the student do not possible to join the evening class, but if they continue with me, maybe again, sooner or later, I will go chapter 3 and 4. What they miss in the morning, at evening, I will explain as well. Now, another one, another important. Suppose this is the 33 PowerPoint. If I continue with the 10 chapter and 20 chapter, if I will not continue, also don't be panic. Why? Because trust me, you are adult. I'm just here to showing you how we have to read, how we have to find out the most accurate keyword. So when you work with me 1, 2, or 5 class, then you can read what are the procedure we should follow. Then you will be your master. You will be your instructor. So I do not need to stay every time and feeding you, because I don't want to make you lazy. You are very compatible and you are strong enough to show you the direction or guideline. But here I am at the beginning, what is my experience from the exam with the teaching to go through all the time with the content, I can share with you. And you can read me, you can read the content, then just follow. And also here is, I said, everything if you in your hand. So wherever you are, everywhere the classroom, because online opportunities. So if you in the car, classroom is there. If you in the bedroom, classroom is there. If you in the toilet, classroom is there. So I said the learning opportunities are huge, but we need only desire to learn. When you stop the desire to learn, means you die. So all the time we are student. So we are student all the time, right? So because of this attitude, life is beautiful and life give us hope, go for next. Okay, and all the time you looking forward to step up your career. So anyway, I'm just going back again to show you what are the content in the fundamental of nursing care. So like next, so if I said if you go in the Google Classroom, you're supposed to get all of this. So like here, so this is the, I mean, some videos. Okay, so same, sometime in my class I also continue the videos, and this video is called ATI. So this is also approved by the National Board of Nursing. So this video is not so long, like 2, 3, or 5 minutes. So you can listen from your home, or when you work with me, sometimes I use the PowerPoint, I explain, you ask me question. Basically, it's the interaction between you and me. And here, sometime I will continue this video, listen this 2 minute what she said, then I will be explain it. And when we work together, we should find out what basically need for NCLEX board exam. And we find out, and I said, okay, this is the information we need to know for NCLEX. And now I'm showing you the other portion, I mean part 2 and part 1 of fundamental, like here. So this one, content, right? So this is the fundamental of nursing part 2, and this is the part 1. So Monday morning, basically we work fundamental of nursing part 1, and evening we work to fundamental of nursing part 2. So part 1, part 2 means we divided total content in 2 different groups, part 1 and part 2. Student who go and has to complete the total course, they must go through all of the chapter, and after the chapter they will sit for quiz, with what are called the class marker. And also our faculty, me or any other faculty, will send you some assignment. So time to time you have to finish the assignment, and for the assignment, their timeline, you have to submit the assignment before the timeline, expire the timeline. So here, main focus right now, what are the content and how I will go through one by one. So, and when you come in between, how you has to catch me up. Like the student who joined 5 days ago and you join after 10 days, how I has to combine these 2 students together. But here I'm saying the Monday, most of my students for here for the RN, they know how to adjust, and they also have some good basic knowledge. So whatever it is, let me explain one by one. The fundamental of nursing part 1, basically this is the chapter list, right? So chapter 1 contain culture, chapter 2 is safety, and chapter 3 infection control. So chapter 2, I'm coming, some student asks me a question, I'm coming to answer. Let me finish this portion first, otherwise we lost. So chapter 1 contain the culture, safety, infection control, elimination, then pain, hygiene, nutrition, and fluid electrolyte. So this is the 8th chapter content in the part 1, right? When you go in the Google Classroom, we mention 2 books there, Standard and Fundamental of Nursing. 2 books, also mentioning the page number. So you can follow anyone. You can follow anyone, right? And also, I give you the PowerPoint. You can get the PowerPoint from the Google Classroom, what I show you in the beginning, but also every time before the class or after my class, Monday, I email you that this is the PowerPoint we are going to discuss, or this is the PowerPoint what we talked today, right? So like culture, awareness, 2 books, book page there. You have to prepare before to join in my class. And what are the resources also? Read all of the PowerPoint, then watch some videos from YouTube. Okay, so YouTube, there are a lot of thousand videos. Which one you have to choose? I don't want you lots, okay, but you need most appropriate videos what we put together in Google Classroom, like ATI videos. Miss Kathy, she explained all from beginning to ending, and it's not too long. And also another video is called Summit College video. This one, like 3 videos about the fundamental of nursing, but every video is 1 hour. Some of the students do not like long videos, so like here, this is the fundamental of nursing part 1, part 2, part 3. This 3 is little bit longer, so if students do not like, no problem, we have a short video like Kathy's video that I show you a few minutes ago, short, right? So here I said culture, safety, 1 by 1 chapter, and like chapter 1 culture, you have to go down. This is the chapter is there, right? So it is also there, and also I said I can email you. Last, also it is important what I talk, like chapter 1 today, chapter 2 tomorrow or next Monday, everything I have a recording. So I email the record to the student as well. So if the student difficult to get me, they can review from my recording. So now you can ask how you has to get my recording. I will email you my recording. So here is something, but you has to tell me that I need your record. Okay. If you request me, I will email you, because sometimes student is some of the students is really brilliant. They catch me very easily. And other things is definitely don't feel discomfort. We are working like a friend, and we like to make a good environment to exchange our views. And it is not that I only talk, you do not talk, and you has to learn everything. No, so many times I learn from you. It is the both side we are step up every times. And other is here, I believe it is your best decision you have taken. Something not related, but I want to share with you, my friend. I went medical school. I went university for my master's degree. I went for associate degree, and I'm doing also the other degrees. So I said it is a big headache. Whatever a federal student loan or any loan, you has to return it back with high interest, because everybody are adult student here. But when you come in small school like us, but we are approved school, we are genuine paper we have. You has to give the money from your pocket part by part, but it is not a big headache. And I said we are very flexible. Nothing look like too much stress or pressure. If you go a big university like 2 years program, you has to run because you have a job, you have a family, you have a kids, and beside of this you have to have some coursework, some extra stress, because their student is too many. They do not headache who coming or who going, who is falling suddenly. They do not headache. There are 1,000 stars in the sky. If one star is fall, nothing happen. But we are small school, we take care of every student. We call them, what is your update? We directly interact, I mean, it's faculty directly phone them, interact them, email them, tell this is the materials need for dentists, and also, and what is the, I believe you are so lucky because you get the chance to talk to the school director. I mean, our CEO, which is Mr. You know who is him. So you directly talk to him, right? But a big university, the 1,000 student, they do not get that kind of opportunities. So I said, whatever it is, just think is the good opportunities. And if you feel this is the problem, but problem, if the problem is there, solution is there as well. So problem is the opportunity to learn, and problem is the opportunities to make you stronger. When you go through the problem, you learn, you be strong for future, and it make you smarter. I said. So don't take problem is a problem. Problem is the opportunities. So whatever it is, I said we has to go one by one chapter. Now, at another answer I want to give you. Like today, this Monday, I finished the chapter number 1, and you are with me. But next Monday, I go chapter number 2. The new student join with me. So they catch me chapter 2. So whatever chapter 1. So tomorrow, next class, both of the students get me chapter 3. Go 4, 5. But after finish chapter 8, I am coming back in chapter 1. Now another question comes. If a student finish all of the chapter and all of the quiz, they can claim that I finished this chapter. I mean, in subject, I do not need any more. I have to go forward, right? So this is the way we work. So now I want to show you the chapter, my Fundamental of Nursing, part 2. Part 2 contained acid base, diagnostic test, laboratory bellows, medication and IV calculation, perioperative care, skill, only 6 chapter, right? But the 6th chapter, but most important, super important, extremely important, because of some unknown reason, NCLEX board frequently asking question from every chapter. Acid base. Some of the student, this is their nightmare, panic, anxiety. They think I don't understand acid base, but this acid base is super easy. We make it easy, and we find it out what you need for exam and what type of question you will get it. And same time I said we have a recording. If you want, which we will send you the link, you can go through, right? So when we work this chapter, we may take all the long about the acid base until to make you understand and be able to answer the question. After finish the chapter, we're supposed to go evolve, right? What are the question bank we follow? Evolve, right? Evolve question you have to solve, and you can find it out what is your level. And after acid base, we have to go for diagnostic test. So diagnostic test means lab values, and also in what medical condition, what kind of test we need. And basically these two together, laboratory values. So NCLEX board will not give you any chat for what are the normal hemoglobin level, what are the normal blood sugar level. You must know. just for missing of this lab below, you missing your license. So what we do, we has to go through the PowerPoint related to lab bills. At the same time, I give you some note where every lab bills in one pages. You has to go through. And then another, disaster for the student, mathematical or medication calculation, right? So you are so good in every field, but you hate the math or mathematics. But if you has to face or get the question in the NCLEX board, just stop to hate. If you should love it, if you do not love it, just pretend to love. So when you have a problem, don't away from the problem. You have to face the problem, because you should know for NCLEX board. And again, I said we have a recording and also we have a PowerPoint, and I had a note what I will give you in my classroom. So everything is there. There are 6 or 7 formulas, but you have to know how to get them. What are the formula and what number where you have to put, right? So we will make it easy for you. And again, I said after finish the class, I will send the record so you can review it. And this mathematical question, like today you know very well, and next 2 months you will never touch it. After 2 months, you will forget it, and it's very natural. Don't blame yourself that your brain is not good. No, your brain is good, but you do not know how to treat with it. Or I said some of the students worked so hard, but they not pass. They are loser. Why they are loser? Because of their thinking. They work hard, but they do not work smartly. They think they are not going to get the license. This negative thinking actually eat their brain and snatch their license. So every time you should think you are compatible. You have to be positive about you, because you do not know your energy. You do not know your brain. But thinking, basically negative thinking, every time eating your abilities. The elephant, what we use in the circus, this elephant do not know what is his energy, because they train up like this. But I said in positive thinking can change your life. So NCLEX board, it is not so hard, but you have to find out what are the key point, keynote you must know. Other things, some of the student even they do not know what they do not know. So we are instructor here can help you to find out what are the important topic related for NCLEX board. Now go perioperative care, other chapter, perioperative care. So it is talking about actually when a patient go for the surgical operation, during the operation or after the operation, how we has to deal with them. What and other things is it is the NCLEX. We are nurses. So this is the skill, right? We has to deal with the patient, right? Which is the theory I said, not always the medical science. And also some skill, like what are the LPN has to do, what are the RN roles, means delegation, then assignment, okay? So prioritization, everything we have to explain. But again, this is the most challenging for the student. Like the student who joined with me today, I think first class is perioperative. Maybe they can get, I do not know acid base or diagnostic. So how can I get the perioperative? Because perioperative is perioperative. Perioperative does not related to the acid base, because Monday class means Monday all day long acid base. So next Monday when you come, no more acid base diagnostic test. So all day you work with me diagnostic test, morning and evening. So it is not related the next, I mean previous Monday. So it is a consequence of this Monday. No, this Monday means this Monday. We, from the beginning to ending, we finish this chapter. So coming Monday, talk about something new, what is not related to the previous Monday. So the student who miss, actually they does not miss anything, because we only know to go forward. After finish the chapter 6, from part 2, I'm going to part 1, I mean chapter 1, acid base. So that student who missed the acid base, if God will, or if she or he want and continue with me, sooner or later will get this chapter again. So this is the way basically we work, and this works for the student because we are working, we have the experience and student passing every time. So here again, acid base, diagnostic test, every times we has to write the 2 books. So it is sender page and also the Fundamental of Nursing 2 books, page number there. So you can follow anyone, right? If you go a little bit down, again the resources there. So here we wrote the syllabi. So what are the content? Who is the instructor? Who is the guest speaker? Everybody, right? And this is the book. And this is the Summit College long videos, what we explain. And this is also the PowerPoint. The PowerPoint total are 13. We divided some in the part 1, some in part 2, right? When you finish, you have to click in this link. If you click there, the page come is called class marker. After finish the part 1, you have to sit for this quiz. Wherever you are, does not care. So put your first name, last name, your email address, and you can start the quiz. After finish the quiz, you submit button, and our school website or email we get automatic notification, and your score will be recorded in our system. Okay, always we have to update the system because it is Florida Board of Nursing demand, and we have to fulfill all of this, because when board come we face, and we have to show it is the student record. They went through one by one, this is their score, because when they come they can ask anyone's student. So we always be updated. So here I said the part 1 and part 2, right? So I said this is the way we work, right? And after finish, when you practice the question, this is the evolve. So every student have the book sender book. The second page contain the PIN number. You have to sign in, put your email, and or open the account. Then you are allowed to practice the question from here. And always I said this 4,000 question from evolve is your real basement. In NCLEX board, first you give you some basement question or fundamental question, what you must answer. So in evolve, you can say you just go left on the bottom, exam review, you have to click, then open. When you open this, it is coming here, then continue. In this section, you have to put study first. Also the exam mode is up to you, which one you prefer or which one work with you, which one you feel comfortable. Study mode, then you have to go.
Hi, Dr. B. We cannot see the full screen.
Okay, let me see. So in this study, then step 2, content area, you have to categorize or you have to click content area. When you put content area, subcategories come. So now my focus, I'm talking about the fundamental of nursing care. So this is the fundamental of nursing care. This is big boxes, square box. We will not click there. We have to click in the small triangle, like here. When you click there, again, chapter by chapter come, right? So like today example, like today we like as an example, infection control, super important for NCLEX. This is 66 question. And if you want, you can reset from here, only new question or all you can get it. You can reset. If you need all question, you can reset it, right? So when you click, you have to begin. So like this is the question, you have to read it and answer, right? If you do wrong, just go like example, I'm just give an example, I'm not read it, like I put 6 and 5, then submit button, and this it is incorrect. No problem. We do not know, so we are here. We want to learn, only need this desire to learn. So what is my wrong? Go in rational and read it, right? Anthrax is an organism. Anthrax is a contact precursor. This is the note you have to know. If in contact precursor, we need universal precursor or standard precursor. What are the universal precursor? Hand washing, wear the gloves, right? So if it is new, like I do not know what are the organism causes the anthrax, is called bacilli anthracis or anthrax. This is contact precursor. They cause the digestive tract infection or skin infection. If you feel it is no, if you know, this is good. If you do not know, wonderful. Just write a note. And also when you go through, I like to request you follow a notebook. What you do not know, just write in the note. Again, I say you do not write all of this. You will be get tired. Like here, I know anthrax is a disease. It is skin contact. Sometimes it's called biological weapon, right? What I know, I do not know, like anthrax can cause digestive tract problem, right? They said contact through the digestive system. So when we eat something, maybe possible to transmitted the infection, contaminated. So if you know it is new, just write only this point, right? So inhale the bacterial spore, then it is easy to spread through any skin cutting or abrasion. If it is new, just go. It is contaminate uncooked meat, right? Anthrax related to uncooked. It is a keyword we must know. But again, I like to request Don't memorize the, okay, this is the question, answer is number 2, number 3, number 4, number 2, number 3, number 4. No, these are not way. So read it, read the question, try to understand the examiner mind, try to understand what they want to know and what are the information related for the NCLEX from here. Just keep note and go for the next question. So this is the way we have to practice the question from the evolve, right? So we have evolve, we have Google Classroom, and also I like to share with you what I mean what are the PowerPoint we can found from Google Classroom, and also you can found I said I can email you as well. So this is no way you miss something, like this is the PowerPoint related to the NCLEX board we use. And now do you have any question?
Yes, Dr. But how you gonna show us for the LPN, please?
Just wait.
Dr. B.
Yes.
Maybe another time?
No, just a few minutes, please. Let me show you. So I said